World Health Organization defines health as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. Let us understand more about mental health, which is a cornerstone of well-being. Yes, Dr. Sunil, when do you say someone is in a state of good mental health?
A good mental health is crucial for overall well-being. A person can consider himself or herself in good mental health if they are able to realize his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, is able to contribute to the society they belong to.
Then what is mental illness?
In simple terms, a mental illness is characterized by changes in behaviors, emotions, and thoughts. The changes could result in dysfunctionality or can cause severe distress in themselves or people around them. It is important to remember that mental illness can vary in its presentation. Moreover, it can be mild to severe in intensity.
Is mental illness common? Which are the common mental illnesses?
Mental illness is quite common. 1 in 4 adults are said to be suffering from some or the other kind of mental illness. The common mental illnesses for which help is sought are depression, various anxiety disorders, bipolar disorder, schizophrenia, obsessive compulsive disorders, substance use disorders, and many others.
So, do individuals only with a major mental illness seek professional help?
Absolutely not. Individuals drop in to seek help for many other reasons like persistent emotional disturbance, relationship issues, adjustment issues, disabling fears, difficulty to cope with routine stressors.
Who can develop mental illness? What causes mental illness?
The fact is, anyone is vulnerable to develop a mental illness. The cause for a mental illness is difficult to ascertain as multiple factors can play a role. Some of the important factors are genetic vulnerability, ongoing personal, family, and social stress, life events, persistent maladaptive coping, substance abuse, underlying medical illness, medicinal side effects, and many others.
When does one seek a mental health professional's intervention?
Seeking mental health professionals' help is very important. The dictum is earlier the help sought, more effective the interventions could turn out. Some of the red flags to seek professional help are suicidal thoughts, significant sleep disturbances, significant weight changes, persistent emotional disturbances, abnormal behaviors like talking or smiling to self, hearing voices in isolation, persistent falls and fixed beliefs, etc.
Are there blood tests or scans by which we can diagnose a mental illness?
Most of the times, in routine clinical practice, we have no blood tests or scans to confirm diagnosis of mental illness. Sometimes, there are other medical conditions which we would like to rule out, as they could disguise themselves and clinically present as mental illness. Example, hypothyroidism in patients can in disguise present as clinical depression. Patients with brain infections can present with abnormal behavior.
So, how do you diagnose if there are no tests?
We mostly rely on a detailed history taken from the individual and or concerned family member. A detailed clinical interview, assessment, and examination plays a crucial role. When appropriate, we also use psychological assessments, rating scales, and other tools to understand the mental health status of the individual.
Is mental illness treatable?
Mental illness is treatable. Underlying changes in the brain's neural chemicals and networks can cause mental illness. We have many medications to alter the same. Example, schizophrenia is typically believed to be caused due to increased secretion of a chemical called dopamine. Antipsychotics are the medicines used for treating this condition, which basically blocks the dopamine receptors and thereby negates the effects of dopamine overstimulation.
Then, in case of management of mental illness, is use of medicines the only option?
With latest advances, there are more and more safer medications available. Hence, pharmacological interventions is a safe and effective strategy in managing mental illness, especially in acutely ill, severely ill, and chronically ill population. There are other strategies like electroconvulsive therapy, repetitive transmagnetic stimulation, and many others. There are many kinds of psychotherapy which are effective in managing various kinds of mental illnesses like cognitive behavioral therapy or mindfulness based therapies, exposure response prevention. These can be planned at the level of individual, couple, or family.
It appears mental illness is common and treatable. What are the possible barriers to seek professional help?
You are right. Despite effective management strategies being available, there are barriers to seeking mental health professional health services like lack of awareness, stigma related to being labeled as mentally ill, myths and misconceptions regarding mental illnesses and treatment, challenge in accessing trained professionals.
Your concluding remarks?
Mental health professionals do see severely ill population who might behave weird or odd due to their underlying mental illness. But it is only a small population of all the conditions we address. So don't suffer in isolation and shame. Come out and ask for help. Get treated and get better.
Mental health education begins with me. 5 key takeaways are: there is no health without mental health. Mental illness is common. The cause for mental illness is multifactorial. Mental illness is treatable. Don't shy away. Take help.